Is your baby drooling a lot? Are you wondering if they could maybe be teething? In today's episode, we're going to talk all about signs of teething and tips and tricks to help manage it.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome to Be Kind Pediatrics. If you're new to the show, my name is Dr. Blair Rolnick. I am a pediatrician and mom myself. And let me tell you, when my son first started teething, I was super confused. So if I could be confused about this, so could anyone. When he was around 3 months old, he started just drooling excessively. And I was sure that he was having a tooth come in. But he actually didn't get his first tooth until he was closer to 7 or 8 months. I just want to start by talking about that because it's also a common question I encounter in my clinic now. When your baby starts drooling, it does not necessarily mean that they are teething. Babies start drooling more around a couple months old, and that's actually because their salivary glands are starting to form, and the drool actually helps keep the gums clean. So it is not necessarily a sign of teething. All right, so let's talk about some signs and symptoms of teething. So first of all, if you think that your child or your baby is teething because they're either more irritable or maybe they're seeming a little less interested in their feeds lately, you want to take a look at their gums. You might notice that their gums are red or swollen, or you might even see a little white nub where the tooth is coming in. Traditionally, the first two teeth to come in are your lower to front central incisors, and then the top two are next, although not everybody follows that exactly to the T. Other signs and symptoms you might notice besides red swollen gums, irritability, may also be loose stools. So this is kind of a teething myth. A lot of people think that teething causes diarrhea. That's actually not true, but it may cause loose stools. So excessive drooling can be irritating to our GI tract when we're swallowing all of that saliva. So it can make our stools a smidge looser, but it really shouldn't be causing frank diarrhea. You may also notice that your little one's constantly chewing on things or putting things in their mouth. They may be having a rash around their mouth, and that's just from the saliva coming into contact with the skin. So these are some kind of soft symptoms that you may notice. Typically, teething starts around, again, that 3 to 4 month mark is as soon as you get your first teeth, although some babies are actually born with their teeth, so that's also not a hard and fast rule. And some babies don't get their first teeth until 12 months or even later, but usually the 12-month mark, I'm like, bring it up to your pediatrician. They might want to bump you over to the peds dentist to have a better look. So now is a good time to pause and talk about things that are definitely not symptoms of teething, or what I call teething myths. So we kind of touched on one of them briefly, but one is that teething causes diarrhea. Teething may cause loose stools, but again, it should not cause diarrhea. So if your baby is having diarrhea, I would recommend that you reach out to your pediatrician for a sick visit to see what else is going on. 2, there is a myth that teething causes congestion. That's also been proven not to be true. It's just that around the age that babies get teeth, they also happen to start getting a lot of viral upper respiratory tract infections. So again, if your baby has congestion, I would recommend that you make an appointment or give your pediatrician a call to see if a sick visit is warranted. 3, that teething causes coughs. So again, just like the congestion, teething does not actually cause coughs. They just tend to coincide. So if your baby has a cough, same recommendation, I would get in touch with your pediatrician's office and see if a sick visit is warranted. And lastly, but certainly not least, my favorite is that teething causes fevers. So there has been lots of research around teething and fevers, and the evidence really points to the fact that teething does not cause fevers greater than 100.4 degrees Fahrenheit. Again, so teething does not cause fevers greater than 100.4 degrees Fahrenheit. If your baby has a fever of 100.4 degrees Fahrenheit as a core temperature, so for those little ones, that's going to be a rectal temp, we recommend that you reach out to your pediatrician. Depending on their age, they may warrant a much more serious evaluation. And secondly, again, it does warrant a call to your pediatrician because we know that teething does not cause fevers. It just so happens that fevers tend to coincide when children are getting teeth occasionally, but there's no actual causation there. So let's say you are pretty sure that your baby's teething. They don't have a fever. They are not congested. They don't have diarrhea. They're not showing any signs of dehydration, but they're a little bit irritable. Their gums super red, and you see that little pearly white maybe making its way through. What can you do to help your baby? So my first absolute favorite baby teething trick is to take a piece of muslin cloth like this one, fold it up like that, kind of make a knob like that one is, and dip it in either breast milk or formula, depending on what you're feeding your baby. Put it in the freezer for 20 or 30 minutes. I usually recommend that you actually don't dip the entire cloth in the breast milk or formula, just so there is a dry part for your little one to hold on to that isn't cold for the little baby fingers and hands. And then let them chew away on that. And you can repeat this as necessary. I like to dip it in breast milk or formula because it's a little bit more enticing for the baby to chew on. But the texture of the muslin cotton and the way that it kind of molds to their mouth and gives them a little gum massage while also being cool, I found to be really effective. So piggybacking off of cool things, anything that's cool can be soothing. So that's cool teethers. You can try putting your breast milk if you're bottle feeding, or formula if you're formula feeding. Put the bottle in the refrigerator for a couple hours. Try giving them their formula or breast milk cold. You can also try gum massages. I've also found those to be quite effective non-pharmacological interventions for teething. So just wash your hands really well. Make sure you get under your nails and between your fingers, and then actually apply a little bit of gentle pressure to the area where your baby is teething, or a little circular massage. You can also use all of those great soothing techniques we talked about. So you can go back and look at the video where we talk about soothing a newborn, but do continue to use all those additional soothing measures prior to using pharmacotherapy for your teething infant. So singing, holding, cuddling, swaying, rocking, baby carrying, these are all great ways of soothing your baby through this tough time. And lastly, if you've done all these things and your baby's still seeming uncomfortable, you can use pharmacotherapy to help your baby through teething. So the two options available are usually either acetaminophen or ibuprofen. Acetaminophen, also known as Tylenol, is appropriate for those babies 3 months and up. Under 3 months, I really would recommend contacting your pediatrician. And then ibuprofen, also known as Motrin, is a great option for those kiddos who are 6 months and up. Under 6 months, babies' livers are really not mature enough to metabolize the medication ibuprofen, and so it really shouldn't be used in that age range. If your baby is older than 6 months, I usually recommend ibuprofen over Tylenol before bedtime because it lasts 6 hours as opposed to 4 hours. Or if they're seeming like they're really in a lot of pain from it, ibuprofen is a little bit of a better anti-inflammatory than Tylenol is for teething, and so that's a time when I might reach for the ibuprofen first over the Tylenol. Otherwise, I would always recommend starting off with Tylenol. And if your baby is still seeming uncomfortable in about an hour, because that's how long it takes for the Tylenol really to start working, then you can, of course, always use ibuprofen on top of that. It is unusual for you to really need both. So I usually ask at least my patients to let me know if they are needing to use ibuprofen on top of Tylenol consistently, or if they're needing to use Tylenol every 4 hours or ibuprofen every 6 hours for more than 2 days. I kind of want to know about that. Again, it may be normal, but usually I like to just have it on my radar a little bit sooner rather than later. So typically teething lasts around 3 days. And once the tooth is out through the gum, it really shouldn't be causing your baby any more discomfort or pain. So that's another thing I'll talk to my patients about. If the tooth is out through the gum and your baby is still seeming irritable or fussy or not eating as much as usual, that is usually another time I will ask parents to go ahead and give me a phone call or text me and let me know what's going on. So teething typically starts around the 4-month mark, although again, there's some great variability as to when a child will get their first tooth, and it typically peaks around 5 to 12 months. Again, don't panic if your baby's first tooth is not erupted or present by 12 months. Again, do let your pediatrician know, do bring it to their attention. They may want to have their friendly peds neighborhood dentist take a look. So now we kind of covered all the tips and tricks to help your baby when they're teething. Let's also talk about some of the things that you should not do for your teething baby. And the first one I want to talk about is the use of gels like Oragel, topical lidocaine for the mouth. You really should avoid topical lidocaine for teething. One, because it hasn't been shown to be particularly effective. And two, because there's a lot of side effects to oral lidocaine for infants, including a very rare condition, but one called methemoglobinemia that can be potentially life-threatening. So skip the gels. Two, amber beads. So the AAP really strongly recommends against the use of amber beads. They are a choking hazard and they are not particularly effective. Three, I usually do talk to my parents and caution them about the use of homeopathic remedies for teething. I ask them to specifically take a look at the homeopathic choice that they are thinking about and ensure that there aren't things like belladonna in there, which can cause seizures and respiratory difficulty and respiratory failure. And another kind of homeopathic agent I recommend avoiding is clove oil, because it can cause a chemical burn to the gum, which actually makes your child in more pain. So do avoid gels. I would recommend avoiding amber beads, homeopathic regimens containing belladonna or clove oil. And I would say, just as an add-on, anytime that you're considering giving your small child or infant anything pharmacologic, including traditional pharmacotherapy as well as homeopathic pharmacotherapy, you should run that by your pediatrician and make sure that there is no reason or safety concern or side effect with that medication prior to administering it to your child. Another kind of tip or trick, if your child has that contact dermatitis, so the drooling rash around their mouth, which kind of looks like a red rash right around the mouth, I would recommend that you do not wipe it off. It is really it's so hard to see the drool, not just want to wipe it right away, but actually what happens is that makes the baby skin more dry and it can often make that contact dermatitis worse. So what I would recommend is that you pat it dry. And even before that, if you see this happening, just apply a good layer of a hydrophobic ointment like baby Aquaphor or Vaseline around the area to prevent the saliva from coming into contact with the skin. It's the contact of the saliva with the skin that causes a drying contact dermatitis. So if you can just prevent that up front with that hydrophobic ointment, that's really the best thing. And then if you see any excessive drool, pat it dry, don't wipe. The big question I also get is, what do I do if teething is affecting my child's sleep? Or could my child's sleep regression be due to teething? That's usually the more common question. And I would say that we probably blame a lot more on teething than is actually responsible for. But if your child has a very good sleep foundation, like a good routine, a really solid bedtime, appropriate wake windows, and that you have been doing this well now for a couple months, having a very solid sleep routine will often allow your baby to sleep through the night despite the fact that they are teething. So I encourage you all to go back and look at some of our sleep videos that discuss sleep routine by age if you're looking to solidify that foundation and make sure you have a really good solid foundation before your baby starts teething. So then what do you do when your baby has their first tooth? So as soon as your baby gets that first tooth, you want to start brushing it twice a day. The recommendation is with a rice grain size amount of fluoride containing toothpaste. And you want to use a really soft, gentle baby brush. And then you also want to start thinking about scheduling your baby's first dental appointment with their pediatric dentist. Lastly, I want to talk about when you should be giving me or your pediatrician a call. So again, if your baby has a fever greater than 100.4 degrees Fahrenheit, core temperature taken with a rectal thermometer, or if they feel warm or lethargic, they're not acting themselves, they're not eating well or eating significantly less, not making good wet diapers or less, not only amount of diapers, but quality of diapers as well. If they have diarrhea, or if they're crying and you're unable to soothe them. So if your baby has been crying for an hour and you have not been able to get them to stop, that also warrants a call or text to your pediatrician. So I hope that you found this episode helpful, especially if you're in the thick of teething. If you have any cool hacks of your own, please leave a comment for the rest of the community, or if you have any concerns, comment them below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.